Hi guys, Praveen from ProPhysio Plus, and today we have lovely Lauren from Melbourne Uni who's going to be helping us out. And we're going to be talking about groin pain and why it is important to find out about the cause of pain. So please like the video, subscribe to our channel and share with your friends. All right, let's jump on in. Guys, so groin pain can be caused by numerous different factors, but one of the biggest reasons why it happens is due to a lack of strength, especially in your adductor muscles over here. So a really simple test that we're going to be looking at is called the Adductor squeeze test, and Lauren is going to dive in, tell you guys a bit more information about it and show us how it's done.
Yeah, so this is a common test used to assess patients who present with groin pain and detect adductor muscle weakness and decrease the risk of groin injuries. The adductor squeeze test involves a patient squeezing the legs together with the aim of reproducing groin pain. It can be done in the crook lying position, so this is when your hips are bent at 45 degrees and your knees are bent at 90 degrees of flexion, and can also be done in supine in the long lever position with your legs out straight. The bent leg position will target the adductor longus preferentially as well. Okay, so this is the adductor squeeze test. So we've got Prab on the floor with his legs bent at the moment. Hips are at about 45 degrees, knees are at about 90. And what I'm going to do is I'm going to put my fists in between his knees here. I'm going to get him to squeeze them as hard as you can. Squeeze, squeeze, squeeze. And then you want to see if this reproduces any of the pain. You can relax there. Now we're just going to straighten the legs out. Pretty much going to do the same thing. Here it's easier to use your elbow and your hand here and just get him to squeeze again. Yep, squeeze as hard as you can. Perfect. And again, we're just going to see if this reproduces any of the pain.
All right guys, so we've got the tests of finding out if you have groin pain or not and whether your adductor muscles here are quite weak. But what sort of exercise can we do? A really fantastic one is called the Copenhagen side plank. And it's quite simple to do. All you need is a bench at your gym or at home. One foot, pop it on top of the bench, come down onto your side in a side plank way, get into your elbow and hold that position. You can hold for 20 seconds, 30 seconds, or you go a bit longer if you want for a bit more muscle tension as well. But guys, that's a very simple exercise that you can do called the Copenhagen side plank. Let us know how you go with it.
Hi guys, now we're going to do some quick fire questions and Prab is going to answer the most common questions about groin pain. The first question is, when should I start to worry about my groin pain?
Fantastic question, Lauren. So first of all, groin pain can greatly vary in severity and intensity. It can be caused by relatively benign conditions such as muscle strain to more severe conditions such as hernias. Usually pain in the groin is a result of a sporting injury or physical activity, and muscle sprains or strains is the cause of pain. However, you should definitely worry about groin pain and get it assessed by a medical professional immediately if you're experiencing these symptoms. So first of all, severe prolonged pain, groin pain associated with back, abdomen or chest pain as well, intermittent intense pain on the lower side of your abdomen. So in males, severe testicular pain, if you're having fever or any swelling associated in the groin region, or numbness or tingling around the groin. And also the big one is altered urinary function. So if you're experiencing any of these symptoms, definitely go and see a medical professional as soon as possible.
Alrighty, so the next question is, how do you relieve groin pain?
Definitely, if you have groin pain, the first thing you want to know is how do I get rid of it? So firstly, getting assessed by a medical professional is the best thing to do, as they will greatly help in the process of understanding what is going on and understanding the reason behind the groin pain as well. The wrong treatment can sometimes lead to a condition getting much, much worse, so definitely getting assessed is your best first thing to do. That being said, here are some tips and tricks that can definitely help relieve your groin pain. So of course, the peace and love principle is a really good one to start off with at the start of your injury. But after a couple of days and going through the more subacute phase, you will follow the RICE principle. So rest, ice, compression, elevation, and obviously referral as well. Also, medications such as non-steroidal anti-inflammatories can help with the pain, getting the edge of the pain. Stretches, depending on the type and severity of the injury. Gentle physical therapy as well can really help. Gentle physiotherapy exercises as well can be a great way to start. And lastly, if it's really, really severe, a surgical opinion might be needed as well to help relieve that pain.
Okay, and so the next question we have is, where is groin pain located?
So, groin pain location, obviously as the name states, in the groin, but usually in the region where the upper thigh meets the abdomen. So around this sort of region down here as well, and often refers to the inside region of the upper thigh. Symptoms are usually located around these areas. However, pain may also be experienced in the lower abdominal region over here, and that at the front of the hips as well. Pain may manifest on one or both sides of the groin.
Lovely, and the next question we have is walking good for a groin strain?
Fantastic question. First thing is, whenever you have any sort of pain, you want to know, can I move, can I exercise with it? And great thing is, walking is usually a great exercise for you to do when you're having groin pain as well. But as long as one, it's not suffering from an acute episode of groin pain that causes high levels of pain upon weight bearing. Second one is high levels of pain being accompanied with significant altered walking patterns. If you're experiencing any of these two things, definitely walking may not be the best thing for you to do at this stage.
Okay, Prab. Now, what does groin pain indicate?
It's related to straining of the tissue, soft tissues such as the muscles and tendons associated with that area, particularly in athletes involved in high impact running sports, so marathon runners, long distance runners, or even sprinters as well. Other causes of groin pain include inguinal hernias or areas of tissues in the abdomen that bulge through a layer of weakened muscles, kidney stones, and fractures. Less common causes may indicate various inflammatory conditions, infections, or lastly, irritations. So there you have it. We've laid out how you can improve your groin pain, so please let us know how you went with it.
Be sure to like us and subscribe to us and share with all your friends.
So guys, making healthy simple, ProPhysio Plus.